Okay, hello. I'm with Dr. Joseph Elfar. I pronounced that correct, right?
You did.
Okay. And we were just talking. It's so interesting. We are the same age. Um, you are 2 months older than me.
Yeah.
Yeah. You're 2 months older than me. You look way more professional than I do, though.
Well, yeah. I mean, it's all a show. I mean, you can't see, waist down, so you don't know if I'm wearing my boxers under here or something. Or
I don't know what's going on.
yeah, I'm teasing. I'm wearing pants. Wearing pants. I promise. That's
You are, you are.
yeah. Okay.
Yeah, I'm in like gym shorts. You are, yeah, you're doing better than me. You look so much more professional. Um, Good for you. And we were talking about the beard too. The beard like makes you look like a man. And I'm just like stuck in that like boy phase. Um, that I guess I don't know. We'll see what happens in the next.
It's all a facade. Just fake it till you make it.
Yeah.
Yeah.
Oh, I'm speaking it, girl. That's all I've been doing. Um, so I'm really excited to talk to you. You are a psychiatrist. Oh, by the way, you're the first psychiatrist that I've had on.
Oh, I'm honored.
Yeah, you're the first person who's not a therapist, like clinical
Okay.
social worker, um, counselor, like, marriage and family therapy, whatever. You're the first one. So you're a trailblazer on Boy Meets Therapy.
So technically, psychiatrists are the oldest median age specialty in medicine.
Oh, really?
Yep.
Oh, I didn't know that. So I remember from psychology in undergrad that all of the founding psychologists were all psychiatrists.
Yeah, I mean, Freud, if you want to, I know he's controversial, but he wasn't even a psychiatrist. He was a neurologist.
He was a neurologist.
Yeah,
Oh,
he
I
was
didn't.
a lot of people don't know that. Freud was a neurologist by training, but he gave a lot to psychology and psychiatry.
Oh, I feel like I should have known that.
Yeah.
Uh, I have a psychology undergrad teacher. One of my professors who wrote me like my letter of reg for grad school would be very disappointed in me in this moment. So I hope that she is not watching this. Sorry, Dr. Cohen.
What if I'm like completely wrong about that? I'm like the fact that you are doubting it, I'm like scared. Like, what if was it Freud
I believe, I mean,
neurologist? I think so. Yes, he
he
was
was.
an Okay, he was an Austrian neurologist and psychiatrist per
Okay.
Wikipedia, and that's an omniscient source. So I'll trust. We're both right. That's good.
Okay. Good. That's a good playing ground.
Yeah.
Uh, so I'm excited to talk to you. I love your content. I think, and this is me bringing just some of my own stuff into this conversation, but I think when I think of a psychiatrist, it has this very like serious undertone and connotation to it. So it's really cool to see someone like on social media that's actually having like real conversations and that is kind of like approachable. I feel like I don't know. I'm not talking bad about psychiatrists. Love psychiatry. I
You
have,
you can talk bad about them. That's fine.
but it's like an intimidating kind of like career to me. So I feel like there's like a relatability about you that I think is really cool.
Well,
To
it's on purpose, Dustin. You are absolutely right. It is forget in social life as patients going to a psychiatrist it's or a therapist. It feels like I'm about to expose myself. And the idea in modern psychotherapy is that we're supposed to be like this blank canvas,
Mhm.
right? And the patient is going to project everything about us. And look, I actually think there's a huge value in that, but there has to be a touch of comfort. Eh, Look, that's my personal philosophy on it.
Yeah.
I don't know if there's an objective right or wrong, but I would rather my patient feel like we are collaborating, that they don't have any ideas that like I'm judging them or I'm moralizing or 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 I am making a determination based on the word they pick. Like somebody with anxiety would just be 100 times more anxious if I don't make them feel a little comfortable.
Mhm. Yeah, that's interesting that you said that because I made a video a while ago about when I first got into my counseling internship. I had all these conceptions about from grad school about what therapy was and what mental health counseling was. And so the blank slate was kind of what I went into it with. And for the first couple of months in my internship, you do an internship for a year. I'm not sure what it is in psychiatry, but we do it for about a year. Um, and so I had to kind of like break that down. because I was really scared to bring myself into sessions with clients because I thought, no, 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 it can't, nothing can be about me. But I think I had a really great supervisor who was like, hey, they're coming to you because you're you and because, they want a human being. And, and that was really, really helpful for me to bring myself, obviously within limits. We're not going to talk about me in the session, but like,
Right, right.
yeah, that was
No,
really,
self-disclosure is so powerful, but it has to pass a litmus test, right?
mm-hmm,
And what's the litmus test? Is this for the benefit of the patient,
mm-hmm,
right? So, for example, Dustin, I know you're fairly open about your sexuality on Boy Meets Therapy. Let's just say there's somebody coming to you who's a homosexual man who's in the closet, right? And they feel really ashamed or conflicted or whatever it is, a whole host of factors.
mm-hmm,
And they're curious. They're like, Dustin, I'm sorry if I'm overstepping here. Are you gay?
mm-hmm,
In that moment, it might be totally appropriate to say, yes, I had similar feelings. Let's talk about it. But let's just say the opposite. Let's say somebody, you're seeing a man or a woman older who hates their child because they're gay,
mm-hmm,
right? They might ask you, Dustin, are you by any chance gay?
mm-hmm,
It might actually be detrimental to say, like, well, actually, yes, I am, and I find your views offensive. They might have no other place to actually like talk about that. And you're like, well, I don't want to make this about me.
mm-hmm.
It's about you, right?
Yeah, that's really interesting. My therapy brain kicked in there and would think, if they asked about that, I would want to bring that into a session and really like, but I have to be defenseless, like I have to take my defenses and I have to put them to the side. And maybe in real life, maybe it's different, but like in the therapy room, I have to like put that aside and I have to say, let's talk about what makes you uncomfortable with this and how can I, maybe I'm the perfect person for you to talk to because you're struggling with your child sexuality. Maybe you're angry. Maybe there are some feelings that you can use me to process those with without maybe saying things that are super hurtful or super damaging to
Mhm.
your child. I don't know. That like immediately popped up for me there.
But yeah,
Um,
no, it's just a range of disclosure, right? Like one might be like a surefire, this is a slam dunk. One might be like, oh, like this might really mess things up, if I disclose this.
mhm. Yeah, it's like a clinical risk. Yeah. Um, I love hypotheticals.
Yeah.
I really do. So I want to ask you about you. So I was just on your page. You went to Rutgers for undergrad and medical school.
Yep.
So what was there anything about that experience? Did you know when you were going into undergrad that you wanted to be a physician or you wanted to work in psychiatry or mental health? What what did undergrad look like for you when it came to like taking this path? Because your path is a long path.
It is a very long path.
I completed
Yeah.
mine, but like yours is you're like, you're really doing it. So I'm
Yeah.
curious like what that was like for you to make that decision.
So in high school, I was kind of like a knucklehead. I didn't really like care about school that much. But when I was a sophomore in high school, my mom got sick with something called Guillain-Barré. And what Guillain-Barré is, it's an autoimmune disorder that can kill you, but it's like a self-limited thing. If you treat it, it's like gone. So it's like a really bad case of MS, right? But it does have a definite treatment.
Mm,
And I remember how sick she was. Like she was like she was paralyzed. I felt like I lost my mom.
mm,
Thank God, she was treated and she went to like a rehab, like a physical rehab. And I felt like in that moment, like medicine gave me my family member back. You
mm,
know, I want to do that. Right. So I thought I wanted to do physical therapy and then I said, I'd rather do medicine and do something called PM&R, which is physical medicine and rehabilitation. And in undergraduate, I studied philosophy, right? So I was already a psychiatrist from that. Like that was it was predetermined for me to be in psychiatry. Philosophy is probably the only thing I still remember from undergrad. I don't remember like orgo or chemistry or any of that. Philosophy, I still read it. I still write about it. I still think about it. Um, I I went to medical school. All the specialties, we rotate through everything, and every specialty has its beautiful moments and, not so beautiful moments. Psychiatry was the only one that did not feel like work to me. It felt like I was like, this is awesome. Like I actually, these are the questions I want to ask, like my other patients, and in other specialties. And I'm like, oh, I get, this is actually the job here, like I'm supposed to figure out why this person, operates the way they do. So it was a natural pick for me. And I think a lot of my close friends in my life were not surprised. They were like, yeah, that makes sense. Like you should be a psychiatrist.
Mhm.
Yeah.
I so in a way, psychiatry kind of found you, is what you're saying.
I think so.
Okay. Yeah, I resonate with that a lot. I'm thinking about like I did undergrad in psych. We talked about it a little bit before, but that's how I feel like it. I feel that like it kind of came to me, and I was like, this is what I feel like I'm like meant to do. So, okay, I have to ask this. This is a question I'm asking for my personal self to
Sure.
you. There's a waiting game, right? Before you kind of get into practice and you get into like, making money, and when you transfer from student to like professional. That waiting period can be really really long, and it can be really really strenuous, and it can feel longer than it is. How did you That's what I'm feeling right now. That's why I'm saying this is selfish, because I'm like, it's so funny. I graduated my program in May. We had the ceremony and everything. And then I got an email from the school saying that I was missing a class. And yeah, huge tear. And so I was like, wait a minute, I have to like take a class over the summer. And it was this whole thing. So I'm still taking the class. What's so funny that I'm talking to you is the class that I was missing was psychopharmacology.
Oh, great. Okay. We'll finish it up right here.
So
Yeah.
that is the class that I'm in right now. And it was so funny when I came across you, I was like, oh my gosh, I just wrote in some discussion board post or whatever on like, I don't know, like lithium or some medication. And I was like, yeah, this is such an integral part of like mental health. But sorry, back to my original question. Like for anyone who is like working towards stepping
Mhm.
out of the student role into the professional role, how did you get through that period? Like what was that like for you, kind of waiting before you're just like, can I be an adult? Like, can I work?
I
Be
I
like,
have I'm probably the worst person to ask about this because I will tell you the the delayed gratification of medical school and residency, especially the financial piece of it. Like I did look,
Mhm,
no, some people in medicine, a lot of people in medicine grew up with parents who were doctors. I did not come from that. We're all immigrants. It's four of us: my mom, dad, my brother, and myself. We were all born in Egypt. I came here when I was a 6-year old, right? So they did not. They worked blue collar jobs growing up, right? So m- m- money was always kind of like a financial security was always a thing in my mind. Now going through medical school is like, all right, like I'm paying to go to work, which it like feels like I'm banging my head against the wall. Residency, I am putting in real doctor work and getting paid minimum wage.
mm,
There was a bitterness that I had that was, listen, it was unquenchable. It was
mhm,
I will just be honest with you. Anyone who knew me then will tell you, like you must have thought I was like only focused on money. And I don't think it was focus on money. I think it was a focus on freedom because I'm
mhm,
closing in on my first year as a doctor now, like as an attending, right? Like the big boy job, right? Money is great. Trust me, when you start making money and you have that like extra wiggle room in the month, it is an incredible feeling. But it stops right there. It
mhm,
does not actually solve any meaningful issue in your life. If you're still feeling like, I don't know, trouble in like a relationship, money does not fix that, right? If you're still feeling a lack of purpose, money does not fix that. Money makes your life a lot better, right? But it actually it has a ceiling effect to its satisfaction. All I will say though is the satisfaction when you first start get your first paycheck and really deposit money in the bank, There is nothing sweeter than that. So enjoy that. Enjoy it. Seriously, it's the
Mhm,
best money you'll ever make. It's the beginning. That's the best money you'll ever make.
mhm. I yeah, I'm thank you. I'm waiting on that moment. So I am I am yeah, I and again, I feel like yours was a couple years longer, but it's just that feeling of going to and I know so many counseling students that in my cohort that were really, really struggling. Um, when it came to kind of working without pay in the internship process. And that's a whole other conversation. But yeah, I good for you for moving through. And thank you for your words of wisdom. That was a selfish question. So I want to move it a little bit into medication, if that's okay.
Sure. Sure, sure, sure.
We could talk about it. So I'm curious about you personally, and I want to get into some like maybe more controversial stuff a little later that we like touched on a little bit before we started recording. But what does it look like for you when you have a new patient? Well, first of all, is there a specific population that you work with, or is there a specific client that you have? Like,
Mhm.
who is if I'm going to book an appointment with Dr. Elfar, like, what am I coming to you for?
Okay, so you're above the age of 16, right? So I'm not child and adolescent trained, though I'm
Mhm,
pretty comfortable seeing 16, 17, 18 as an adult, right? So 16 and up, I'm pretty comfortable seeing that up to like geriatric elderly. Look, I don't, if any patient of mine is listening to this, I just want to say I love all of my patients. So I don't like have a favorite patient. I'm sure some people think I might or think their therapist or psychiatrist might, but I don't. My favorite age range to work with is young adults. So like 19 to like 25. I love this age. I love working with these people. I feel like this is like such a foundational part of
mhm.
life, and they people in that age need somebody in their corner, and I like being that person for them.
That's it's also really interesting too, that age group, because that's kind of when you're there. It's a huge transitional age, but also it like 25 is right when like the prefrontal cortex is like, I'm done. Right? It's
Mhm.
like this is
Mhm.
what you get. So you have all of these, yeah, these like this age group of people that are like trying to figure things out, and they also, yeah. I'm gonna before I fall into a hole of like of me like harping about that age group, I um I want to move into when you're working with someone. One of the questions I was thinking was there's a lot of medications, right? There
Mhm.
are so many medications, there are so many different types, you name it. What does it look like from a psychiatrist point of view when someone's coming to you with a particular issue with which medication do I prescribe first?
Mhm.
How do you what does the process look like for you for, yeah, this is the one I'm going to go with for this person? Or how is that decision made?
First step is diagnosis.
Mhm.
That is the absolute first step. So I will tell you, I think diagnosis in mental health is something that is it is hard to teach, right? Because we don't there's no blood pressure that tells you you're depressed, right? There's no blood test that tells you, you have like some, some quality of a cluster B personality disorder. So like that would be really nice if we could be that precise, but we can't. So in mental health, you and I are the MRI. We are the scanner.
I'm gonna.
Patients,
I just want to run away.
yeah, well, listen, they go to you,
Hmm.
you assess, and you make a clinical diagnosis.
Hmm.
So, so I guess the first step is like really finding the pain point. Like, why is this person coming to me today? Right? Like they tell me I've always been anxious. It's like, all right, well, okay, and you're 25. Like, why are you getting treatment today? Right? And I'm not like interrogating them, but like maybe they like didn't believe in it, or maybe they thought they'd get judged and somebody opened them to it, right? Maybe they saw TikTok about it and said like, oh, I want my life to be better, right? So I want to find out what the pain point is. I want to find out the structure of their thoughts, right? I asked people very specific questions like, do you get a ruminating thought about X, Y, and Z, right? Or what about this? Or what about that? I really get into the weeds with it because diagnosis leads everything else, right? So once I establish a diagnosis, or once I'm fairly convinced of something, I feel like maybe a lot of people don't feel this way with psychiatrists, but I ask my patient, do you want a medicine for this? Some people are truly not ready to be on medication,
Mhm.
and they did not think they had an option. They thought I was like an authoritarian, like, I say you take Lexapro, you take it, right? Well, no, no. In fact, I actually don't want you to take it if you are not convicted. If you don't think this is the right move for you, don't take it. I would rather you come to it on your own than me force it on you,
Mhm.
you know? So as far as picking a medication, look, SSRIs, I don't know if you went into your psychopharmacology class, like, the SSRIs like fluoxetine, escitalopram, sertraline, vilazodone. There's a million of them, right? Though they all work on the serotonin receptor in different parts of it, depending on their half-life, their interactions, how they get broken down in the liver, right? Like with the CYP system, some medications in some instances might be more appropriate for other people. So Prozac, for example, fluoxetine, has the longest half-life of any SSRI. So what's nice about that? Let's say somebody's being tapered off of Lexapro and they're getting the discontinuation symptoms, right? Which is like the brain zaps or whatever, right? You give them Prozac like 10 milligram at the end so that they get very smoothed out,
Mm.
right? It's a smooth discontinuation of the medication, right? So I think psychopharmacology is an art, right? There's no one size fits all. Um, I don't know if I feel like I rambled. I don't know if that answered your question
This
meaningfully.
is well, let me just tell you, this is a yap zone. Like this is
Oh,
a
okay,
yap free
great.
zone. So that's what we do here.
Okay,
Um,
great.
yeah, so I'm interested. You mentioned something about people coming in and saying, I saw this thing on TikTok or whatever. And I have two kind of opinions about this that I want to turn into a question. On the one hand, I do think that uh TikTok and talking about mental health on TikTok can be a lot better than some of the other things that are on TikTok, right? It's like, if we're going to be on there, of course, I want to see the cat video and I want to see the dog video and I want to see, brain rotted, whatever. But it's cool to also be able to hop on there and see like something that's like somewhat educational or like, whatever. I think I see like history stuff on mine. Mine's mainly mental health, is what mine is. And I learn stuff all the time. And so I think what I'm curious about asking you is, what do you think the impact of that has been when it comes to people coming in for psychiatric care? Because I feel like it could be one of two things. It could be someone's coming in because they genuinely had an issue and they didn't have a word for it, or they didn't understand that what they were experiencing maybe was atypical, or, anything in that avenue, versus someone who saw something and they're like, wait, I have a couple of those symptoms. I must have ADHD. Or I have a couple of those symptoms, I must be
I'm
depressed.
autistic. Yeah,
Yeah.
yeah,
Well, that's the
yeah,
one I was thinking of too, is a big one that I see a lot
yeah.
is autism, is like
Yep. Me
these,
too.
yeah, these little things that are, I must be autistic because of X, Y, and Z. And it's like, well, you can also just, have this.
So
I'll
I have
turn
the
it off.
DSM here with me.
Wait, is
I
mine
did.
there?
I wanna read something in the DSM because I think what happens is people learn about one symptom and they will say like, okay, I have this symptom, thus it explains why I have ADHD and why my whole life has been like this. It's like, well, the DSM itself in the introduction will write the use of the manual. There's a part in here that pretty much tells you do not under any circumstance, like, there has to be an expert using this to diagnose,
Hmm.
right? And it also has to be someone who's like not doesn't have any baggage with you, right? I I'll tell you, I get jokes all the time like, do you diagnose, like, I'm married, like, do you diagnose your wife? Do you diagnose your friends? Here's the funny part. I actually can't. I'm too biased. I have
Hmm.
emotional relationships with these people. I can't think clearly about what's going on with them, and I wouldn't try to,
Hmm.
right? I see them in a specific context. That is not an objective one.
Hmm.
Not saying that I'm objective when I see a patient, but it's certainly more objective than somebody who has love, right? Or feelings or emotions towards somebody.
So when that client or when that patient comes in, we use client, and when that patient comes in to
Mhm,
the room and they're saying, you know, I saw this TikTok or whatever, whatever, whatever. What does that look like for you saying,
mhm.
like, how do you approach that?
Yeah, sorry, I like totally did not answer your question. Sorry
You
about
are
that.
you're giving me everything that you're giving me life right now.
No, thank you, Dustin. I appreciate that. The So social media and mental health. The reason why I started posting on social media was for this reason. I
Mhm,
I saw so much nonsense, like genuinely harmful nonsense on the internet. And let me tell you, listen, I saw people who are ADHD influencers. I'm like, what the hell are you talking about? Like, you are taking a psychiatric diagnosis and making it your personality. That is like a fundamental psychopathology. Like,
mhm,
this is psychopathological. And then you have 13, 14 year olds downloading this on their brain, and they're like, oh, like if I fidget with my leg that means I'm like autistic, like I'm stimming. It's like, no, you're not, man. You are a 13-year-old. Like,
mhm,
so and I'll tell you what ends up happening. So there are people who fall into it, right? Like the 13-year-olds, right? They'll fall into it, or people who just have an underdeveloped sense of self.
mhm,
Then there's the people who have a better developed sense of self, and the parent of that 14-year-old. This kid is talking about stimming and ADHD and autism and whatever. And their parent is like, where are you learning this? And then they see the TikTok and it's like, it looks like somebody who's in mental health. How does that parent now feel about taking their kid to come see me?
mhm,
Dr. Elfar must be the one convincing my kid he's sick. And it's like,
mhm,
no, I'm I am actively trying not to do that.
mhm.
Right? So it's a big cultural thing, it's a big social thing. I think look, I think doctors in general, psychiatrists specifically, right? They, they're too professional to be silly on the internet, right? And I have a hard time being as silly as I want to be on the internet because I mean, like, I'm just a professional, right? Like, this is just like I'm just also not that silly. Like, maybe I'm a little silly in my personal life, but I don't want that perception. But if you are not if you're not going to be silly online, the whole point of being silly is so that people watch the longer videos, right?
Mhm,
About Zoloft and about, like diagnoses, right? That's what so I'm an actual professional and I'm speaking about what I'm a professional in, right? I'm not speaking about politics. I'm not speaking about, something I'm not expert in. I'm only speaking about what I'm an expert in.
mhm.
I I still didn't answer your question though. You said,
No, 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 you're fine. You're
yeah.
fine. You're fine. Um, I'm curious about you said something about
Yeah.
differences. So it's interesting because I do know that there is like a cultural stigma when it comes to diagnoses, especially when it comes to mental health. And so what does that look like for you in your practice or anything that you've encountered when it comes to kind of the mindset of, oh, you know, you've been going to this thing and seeing this thing, therefore that thing must be making you like X, Y, and Z. Um,
Mhm.
so I'll use an example. I have a friend of mine who I was at dinner with the other night, and he is from China, and he was talking about being really, really scared to come out to his parents. And one of the things that he mentioned was he said, I feel like my parents are going to think that I moved to New York and New York made me gay. And so that's kind of what was popping up for me when you were talking about, you know, a parent seeing something and thinking, like, oh my gosh, this is making you think like X, Y, and Z. But obviously, like when it comes to mental health or like sexuality is the example I use, there's like a very real, like obviously
Mhm.
like scientific basis behind a lot of the decisions and diagnoses and medications and all this stuff. How does that come up for you? Or maybe not even in practice, but just in opinion or thoughts, or if it comes up into practice, like how do those cultural differences come up for you as someone who works in a field that is so stigmatized?
I will tell you, cultural factors. Look, if you are not aware of some people, you know, raise their nose to cultural factors. Like, I'm a doctor. I don't need to know about your culture. Well, look, you cannot care for someone if you don't see them, right? You can't, right? So if somebody is telling you, this is what my culture expects, you are not supposed to ignore that. That is a fundamental part of who this person is. And if you're trying to treat that person, you have to acknowledge it, right? So it doesn't matter what your beliefs are. It's not about you. It's about the patient, right?
Mm,
So for example, let's just say there's medications that you have to take on a full stomach, right? And you have to take them in the morning. And there's some medications like that. And I have a patient who's a Muslim who is fasting Ramadan,
mm,
right? They're not eating in the entirety of the day. I have to, instead of saying like, hey man, break your fast, screw your religion, I'm saying, all right, how do we work around that? How do we still make sure you're okay while making sure we're adhering to the to your faith and to what's important to you,
mm.
right? My opinions is, but I think you can overdo it. So I will tell you something. I'm all about, look, effective therapy and psychiatry is two parts: affirmation and confrontation. You cannot do confrontation before you have money in the bank with somebody, right? I can't tell you what's wrong with you if you don't trust me. I never saw you. I never heard you. So you have to affirm people. But it doesn't stop at affirmation. You also have to confront them like, hey, have you noticed that you keep having these breakups the same exact way? And you're always the victim, and you're always like hurt in the same exact way. Do you think it's every partner you've been with is like this? Or could it possibly be that there's something going on with you? Right? What do you
Mm.
think it is about you that makes you get treated that way? Not victim blaming you, but what what do you think, where do you think it goes wrong? You know? That has to happen. Unfortunately, sometimes it doesn't.
I my brain like blew up when you said that with all these things because I'm just all the therapy and everything is because well, what initially came up was I hear a lot of people that that have therapists or have had experience with therapists that over validate. And we know that like validation is so important in mental health. Like we know that it's really, really important. But at what point do we, as a clinician, and I'm like saying this as someone I admit, like my experience is just the year that I did my internship, um, is at what point do we say, I'm going to call your bullshit? Because this is the fourth relationship in which someone has told you, I can't be around you anymore.
Mhm.
You know, I cannot validate this. And there's a way clinically to say it, right? That looks a little more loving, you know, that is a little more challenging. But I think that's such an important thing that you brought up is the challenging aspect of wait a minute, hold on. Like one time, okay, two times, maybe, three times, four times, we're looking at a pattern. And like, you know, in mental health, we have a responsibility to say, hey, I noticed this pattern and I cannot I validate your feelings, right? Like I understand that you feel very upset and I want to be here for you in that. But also like there's some kind of pattern that's happening that is, you know, the arrow's starting to turn back around to you. I used to
Mhm.
do this thing in my internship. I love Judge Judy. I love Judge Judy.
Me too. She's very sassy. She's my
I love
favorite. Yeah.
I used to tell my clients, I would say, okay, I need you to hold on because I'm going to Judge Judy you for a second.
I like that.
And they would be like, okay. And I'm like, I'm really preparing you because I'm going to go in on you. And they're like, okay. And they would bring up an issue like, you know, my boyfriend won't stop texting me. And I'm like, did you block him? And I just go in with like all the things. And then I can tell usually by their face, they're like, okay. And then I step back and I'm like, how was that experience for you? Like, you know, and every time it was always this like, I really just love Judge Judy. I want to incorporate her into therapy. But yeah, there was always this way. What you're talking about, I think, is rapport, right? Is like, I have to have this investment with you before we can really do anything else. This is so funny. This is why I love these conversations because I have all these questions about medication and we're like literally having more fun with something else. But yeah, is that like rapport and that accountability? Because I can't be like an effective person for you if I'm just validating what essentially is your bullshit. I
Look,
don't know.
look,
Are there any thoughts that are
look,
coming up for
look.
you? I feel like I just ranted.
No, no, no. I mean, welcome. This is a yap set. This is a yap zone, right? As you said. So, um, look, I, pe- you know why you got to validate people's bullshit is because sometimes, like, they haven't even gotten a chance to express that to anyone because maybe they've been told by like an authoritarian parent, like, suck it up, right? And now they want to express a paradoxical feeling, right? I hate my boyfriend, but I also like the attention he gave me, even though I know he's objectively like a bad person, right?
Mm,
Like, and 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 I have those two feelings in my heart. How can I? Where do I have any space to let that out? Right?
mm,
It's a beautiful thing that we get to be at a place where people can share paradoxical feelings, right? And put words to them, right? And say, hey, and patients might say like, well, I'm so irresponsible for that. It's like, yeah, but that's actually your experience. Like that's how you're feeling, right? You're not a criminal for feeling, right?
mm,
That alone is very therapeutic. But then it's like, all right, you've built that kind of rapport. Now it's like, all right, I'm dating this new guy and the same thing is happening. And it's like, why do you think this is happening now? But I've built rapport with you, right? We have, I see you, you know that I see you. So when I confront you, I'm not confronting you because I'm annoyed with you. I'm confronting you because I listen to you,
mm.
right? So it is the first step to that, honestly, Dustin, as a clinician side, you have to check your own transference, like your countertransference. How is this person making me feel?
Mhm.
Right? Like am I actually annoyed at them?
Mhm.
Right? Or do I really like them? So I'm like not confronting them,
Mm.
right? Well, what is it, right? You actually I have a video, one of the videos that went viral recently was about this. Like um it was my experience treating somebody who had a suicide attempt after attempting he was engaging in behavior that was harming children. So
Mhm.
that's all I'm going to really say about that. And though it was somewhere along my training, and I got called for a consult to assess for suicidality. So I'm supposed to be providing care for this guy,
Mhm.
right? And every muscle in my body wanted to just like kill him myself, right? Like, but the idea is like I have a certain job to do,
Mhm.
right? I am not the judge. I am not the jury. I'm a doctor. Let me do the doctoring part the best way I can
Mhm.
so the judge can do their job the best way they can and the jury can do their job the best way they can, right?
Mhm.
Because that and it's hard though, but you have to check yourself.
Mhm.
You have to check yourself.
I love what you said about the paradoxical feelings, right? Of like two things being true. Like I have this huge part of me that's saying, "Well, I really feel this way," and then this huge part of me that's saying, "I really feel this way." And it's like, okay, how do we have these two parts have a dialogue and find some kind of
Mhm.
common ground within us? So it's interesting. I want to ask a question. I want to ask a slightly controversial question. So can this is a question that I saw. So as a psychiatrist, like, can big pharma influence how psychiatrists prescribe medication?
Absolutely. That not just psychiatrists, everyone, right? And I'm talking about down to like those free pens they give you, right? That has been actually like studied, shown to influence prescribing patterns. So, and here's the thing: the way to reduce that happening is being acutely aware of it. That is actually the only way to reduce it. There's like this been shown also in research. Uh, so, and look, is big pharma evil 1000% of the time? No, right? Nothing is like that. Nothing is black and white, right? Look, there are some medications that come on the market that I look at how their mechanism of action works. I look at the clinical trial. And I'm like, oh, this actually works really well. This is
Mhm.
a novel mechanism, right? There are some meds that I feel like are just um, patent patent extenders, right? So like they'll take two old meds, put them together, and say new medication, but it's not a new medication.
Mhm.
But it's paid for by insurance companies as a new medication, or charged at a patent rate. So now it's a new med, but it's not a new med, right? So that's why I think like being a good psychiatrist, being a good any professional is you have to like really know your stuff. You have to know the deep stuff so that you're not swayed.
With Big Pharma aside, I'll take them out of the conversation. When do you think someone needs to start considering medication? I know that from like our end, right? Like I just took a class on this, whatever, but like, basically it's like if we're seeing like a specific pattern of, someone who is, has depression that is really, really maybe treatment resistant on the psychotherapy side, or someone who is having anxiety that is really getting in the way of them functioning in their life. That would be a key to me of, okay, this is a time when we need to start exploring what the pharmacological options would be. I just wanted to say the word pharmacological because it's a big word. Like
You
what
did
would
great.
that thank you. What would the like pharmacological options be? When do you start to say, okay, maybe we should start incorporating a medication into this treatment?
I will tell you, I saw that question that you put in the Google Doc. I have a hard time saying there's an objective line because I
Mm,
think the line is subjective. What I mean by that is not the dysfunction is subjective. Look, I think somebody can experience 1 out of 10 anxiety and say, this is too much. I can't tolerate this. And somebody could be living day to day 8 out of 10 anxiety, right? And for whatever reason, they cannot get themselves to a place where they can say, I might need a medicine to help me through this, right? There are a lot of barriers for people to do that. I I find collaborating with the patient always more effective,
mhm,
right? There are very rare instances in which there's treatment over objection, and that's usually done in hospitals or long-term institutions. People are very psychotic, very sick. They have no insight. That is not people we're seeing in outpatient, right? So I want the patient to come to the decision about, I want to consider a medicine because I feel like it's ready, doc,
mm,
right? Or how about this? Give the patient so much space that they ask me, doc, do you think I should start it? Like, be honest with me, right? And I say, well, I have seen X, Y, and Z in the past. I have seen it get much better with ABC. If it doesn't work, I'm not abandoning you. I'm not going to say, all right, it doesn't work. Like, you suck, get out of my office. I'm going to say, all right, like, let's taper off of it. Let's try something else. Let's try a different approach. I'm here for it, right? I'm not trying to prove a point. I want you to get better. And if you want that too, I'm here to help you. It has to come from the patient. So I think people are ready for meds when they are like, this is becoming too unbearable for
mm,
me, and I need to solve this issue.
mhm. Oh my gosh, I have so many things that are popping up. I'm going to be conscious of time though. I'm going to ask you one more question and then I have like a final question that I like to go into. So, this is something that there's probably a lot of opinions on and this is probably a whole other discussion. But why do you think so many people have bad experiences with psychiatrists? Like I know for myself personally, I know friends of mine, I know even clients that I had that would describe experiences that they have with psychiatrists. Psychiatrists can get a bad rap. And yeah, I mean, I can think off the top of my head like probably two or three, maybe even four people that have had bad experiences with psychiatrists. And obviously you can't speak for the whole field. But I'm curious about like kind of your take on this of like where this might be coming from, or I don't know, I don't know what's going on there. Is anything coming up for you when I say that to you?
It's a multifaceted answer, but I will say before I say about the quality of psychiatrists, I will say you have to be aware of the selection bias, right? If I went to a psychiatrist and I had a mildly pleasant experience, I had a little bit of anxiety, took some Lexapro, and now I'm okay. You're not going to hear me shouting from the rooftops about that, right?
Mhm.
You're just not. Oh, Joe's looking better. Joe, you know, is, finally got that job he's been like, working towards. Yeah, because I had a little bit of anxiety and I treated it. However, if I had a horrible experience with psychiatry, you are going to hear about it,
Mhm.
right? So the question is like, is it is it that everybody is having bad experiences, or is it that if you had a bad experience, you're more likely to share it,
Mm.
right? And this is not to defend some psychiatrists. Like some psychiatrists are god awful, but I will tell you, my patients, and maybe they're all just trying to make me feel good. I don't feel like my patients have bad experiences with me. I feel like we have a really great relationship. You know, I don't think I'm like unique there. I think a lot of psychiatrists, a lot of my colleagues that feel like are great doctors. Some of them I don't, but some of them I do.
Mhm.
It I So that's one part, selection bias. The other part is, look, psychiatry is wholly undersupplied in the United States. I mean, we have a shortage of like 30,000 psychiatrists, right? So some of these people are very overworked, right? And they're drained. Some of them are just not that good, but they're the only option in town,
Mm.
right? So there's a multitude of reasons why doctors stop providing the care in healthcare. I think people get jaded over time. I think I just have the luck of being younger right now, but maybe in like 5 years I'll be like sadistic and jaded, and all my patients will say this guy's nuts, right? But I I don't know. I see it as a lot of constraints on doctors. I don't think any doctor is doing it because they want it to end up that way. I think they end up that way due to a confluence of reasons.
Mm. Yeah, and I also want to acknowledge that like a lot of people have bad experiences with therapists too. And it is kind of really dependent on like the individual. I think maybe with psychiatry it's so much more difficult because I've heard, people having it takes them X amount of months to get an appointment or because of what you're talking about because there's such a shortage. And so I think when they finally see someone, they're thinking, I need like, blah, 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 blah. And yeah, it can be really difficult. But yeah, I want to acknowledge as well, like that I've heard of a lot of, experiences that people have had with therapists, even seasoned therapists, 10, 20, 30, year therapists, maybe doctoral level trained, that I've heard some things and I'm like, I cannot believe that somebody like said that to you in a session, like under any circumstance whatsoever.
Hmm. Hmm.
Um, yeah, so I just want to acknowledge that as well. I do want to be conscious of time, so I'm going to ask you my closing and my final question. So I've been asking everybody this. Um, so I love to hear a good quote. Like I love to hear, someone said this to me and it changed blah 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 blah. Blah. So I'm curious about some of the best advice you've ever gotten, or that includes like maybe a memorable quote that you heard or something like that. I can tell you mine. I've shared it with everybody.
I want to
Um,
hear it.
and this is, if you've listened to this, you've heard this a million times, but there's a quote by Nicki Minaj, and she's accepting an award, and she says, "Follow your dreams, because one day you'll wake up and your dreams will be gone, and you'll be mad at somebody, but be mad at your goddamn self." And I heard that, changed my life. And so I'm curious about if there's anything like any quote like that from you or from a person or someone you've heard or whatever that you were kind of like, you know what, I really am glad that I heard that and I'm going to stick with that for a little bit.
think I think so. I saw that question on there, and I'm glad you warned me about it beforehand because I was like stressing out. I was like, I there's so much good advice I've had in life. I want to make sure I say something useful. So I came down to two, and the first one, it's not like a direct quote, but it's a something that's been reinforced to me as I mature and grow and all of that, which is be present and allow yourself to experience.
Mm,
And I'm not talking about only positive feelings. Every feeling. Like Experience the tragedy fully. Experience the unmerited joy fully. Experience the heartbreak fully, right? Cry. If you want to cry, cry. And don't shame yourself for it, right? Experience fully without shame. I think people don't realize they don't need the permission for that. But oftentimes they're not allowing themselves to do that. It's like, well, why can't you? Like, why can't you be a human being here? Right?
Mhm,
So I don't know how you could put that in a quote, but the idea would be like experience life without shame or judgment,
mhm,
with yourself at least, right? That's the first one. The second one is it's a quote everybody knows and it's in the Bible, but I'm not actually referring to this from like a religious perspective whatsoever.
mhm,
You know, there's a in the Gospels, Jesus will say, "Love your neighbor as yourself."
mhm,
That's a beautiful sounding thing, but says love your neighbor as yourself, meaning you have to love yourself, right? And what does that look like? What does loving yourself look like, right? Is loving yourself meaning pampering yourself, right? Like I I love myself, so I'm going to eat ice cream and sit on my couch all day. That's not love. That's enabling,
mhm,
right? So, okay, I wouldn't do that to somebody I love. All right, so why do you do that to your kids? Why do you do that to your friends? Why do you do that to your neighbor? Right? So love your neighbor as yourself sounds altruistic, but the command there is actually learn how to love yourself
mhm.
first. You can't love anyone else if you don't love yourself.
Well, that the quote by RuPaul?
No, go for it.
I don't know if you know it. RuPaul says that every episode. He says, "If you don't love yourself, how the hell are you gonna love anybody else?"
Exactly. Exactly. That's it. That's what I'm telling you. This has nothing to do with religion necessarily. I think this is a human thing. You can't love anyone else if you don't love yourself.
Yeah, that was really beautiful. Thank you so much for chatting. Thank you for the conversation. I'm excited to see what else you do on social media. I am clocked in, and you're in my scrolling routine. So I really thank you so much for coming on it and chatting.
Dustin, you are awesome. Thank you for letting me ramble.
Oh, please, you can ramble anytime you want to. I love a good ramble session.